The topic we have chosen is whole body CT screening for cancer and whether or not it should be used for asymptomatic patients. Whole body CT scanning has been marketed as a means of screening for early signs of illness in patients who otherwise would have no other symptoms or disease risk factors. The argued benefit of whole body computed tomography is that a disease such as cancer can be treated more successfully if it is detected early on. CT scans can be and are invaluable in society. They are highly beneficial in circumstances where you are investigating suspected problem organs or suspected disease. The problem with whole body CT scans is that the risk significantly outweighs the benefit. It is a medical procedure that involves a large radiation dose and can come with little to no benefit to the patient. The Australian Department of Health has warned that a whole body CT scan with an effective dose of 10 millisieverts may be associated with an increase in the possibility of cancer by 1 in 2,000. This cancer risk outweighs the possible health benefits for healthy people under the age of 50. There is, of course, a chance that a latent disease is uncovered, and that is a possible benefit of a whole body CT scan. However, it is important to limit the amount of radiation a patient is exposed to and limit the suffering that may result from this dose.
So the CT scan is a non-invasive, painless and relatively safe procedure that can assess a body's past structure or shape and detect serious injuries or diseases such as cancer. CT have revolutionized the capabilities for imaging, image-guided therapeutic intervention and improved targeted radiation therapy. It is believed the whole body CT scan plays a key role in the early detection of disease. Also, researchers want to raise people's consciousness about the fact that there is now a tool available to detect 3 of the major killers in our society: heart disease, lung cancer and colon cancer. However, patients whose scans show no evident problems may lose in the long run, as the exposure of whole body to radiation is too high. People then believe that they don't need to participate in other healthcare actions that are beneficial for them. So should be a whole body CT scan used for asymptomatic patients? The advantages of a full body CT scan are limited at the moment, as the risk of such procedures seem to be higher. However, when a patient is suspected of having a disease or illness, the benefits of screening and potentially discovering and treating the illness outweigh the risk of radiation. People can also detect a hidden illness or an early-stage disease before they become more advanced. For example, Dr. Michael Brandzawatsky, a radiologist with wide experience in targeted CT screening as well as whole-body CT, has found that in screening self-referred patients older than 40 years, about 1 in 100 will be found to have cancer.
Currently, whole-body CT has not yet shown any benefits compared to localized CT scans for good reason. Patients who undergo this procedure, despite the intention of seeking possible or early detection of various cancers, are exposed to anywhere from 4 to 24 millisieverts. Compared to just 0.04 millisieverts in a chest X-ray, the risk of developing cancer certainly outweighs the health benefits when asymptomatic patients are exposed to such dosages. According to the Department of Health, an effective dose of 10 millisieverts could be just enough to initiate the development of cancer in approximately 1 in 2,000 patients who undergo whole-body CT.
Since there is a less than 2% chance of tumor detection in screened asymmetric patients, the risk of false positive findings would further lead to more unnecessary changes in procedures, again increasing the likelihood of progressing the rate of development of cancer. It is because of these factors that the FDA has described full-body CT scans as irrelevant in asymmetric patients, especially as a preventative healthcare measure, also claiming that the test is to be performed on at-risk populations and only in circumstances where the pros outweigh the cons. For instance, cases where the specialist suspects the presence of a specific disease is only when full-body CT scans are applicable for diagnosis. Through our research, we have come to a conclusion that the cons outweigh the pros in regards to using whole-body CT screenings to find early signs of cancer in asymmetric patients. Full-body CT scanning is seen to be as a peace-of-mind procedure, and 98% of participants show no early forms of cancer. Adding to this, the individual is exposed to levels as high as 24 millisieverts of radiation, which is deemed to be unnecessary amounts of exposure for a precautionary procedure.